Hello, everybody. We are back with Juliana Longoria from Rothaus MD, who's going to walk us through just some of your skincare basics. Because one of the things that I recognized as she and I were talking the other day is that I'm not cleansing my skin right. And so we're going to go through just the basics and then talk about all the different layers of products that you can put on, how and when and where and why. So Juliana, tell everybody a bit about your basic cleansing routine. Because I was shocked to hear that if I can only commit to doing it one time during the day, it's supposed to be at night.
Yes. So hi, everyone. Happy to be back. Yes. So I get a lot of patients who either don't cleanse their skin every day or go to bed with the day and with everything that's been on there, everything that throughout the day you're walking around the city, we're exposed to so many different toxins and we wear makeup and we sweat and there's dirt in the air, exhaust fumes, you name it. And then we go to bed with that. So if you absolutely are one of those persons that just absolutely will wash their skin once a day, make sure that it's at night. You want to go to bed with clean skin so that your skin is able to rest itself, just like our body needs to rest, and it's able to breathe and do what it needs to do to, function and look its best.
Right, because our skin needs that oxygen too, right? And like that clean,
Our
healthy.
skin needs to rest as well. So if you're only going to do it once a day, please do it at night before you go to bed. If you can do it both morning and night, great, fantastic. If you're one of those that has very dry skin, there's ways to treating yourself twice so that you're not over drying your skin, but we can get into all of that.
Amazing. So let's start with the basics, right? So it's at night, I'm coming home, I'm caked in makeup, dirt, and disgustingness from the day. What's the process?
So you always want to make sure that you're cleansing your skin in a gentle circular motion, but for a minimum of 60 seconds to make sure that you're really getting everything off of your skin. If that seems a bit too long for you, you can always do a double cleanse. Cleanse once in circular motion for as long as you can, rinse off, and then do a second cleanse. Just to make sure you're really removing everything, because as many of you will see or have noticed, when you're cleansing your skin, if you only cleanse once and then you wipe your skin with a towel or cotton, you'll see that you find there's still makeup on there or dirt or oil, something. So you always want to make sure that you're double cleansing or at least cleanse for 60 seconds.
And should the cleanser, should it always be an exfoliant each time, or can you do an exfoliation each time plus the cleanser, or how does that work?
So some cleansers do contain some chemical exfoliants like your AHAs or your BHAs, which are your glycolics, your salicylics. Those are gently exfoliating your skin chemically, not physically. I'm not a big fan of physical exfoliators for many reasons. Most people don't know how to use them properly and maybe scrub a little too hard. Plus, they can also cause tiny little micro scratches on the skin. Somebody who has very sensitive skin, a rosacea, or a lot of redness in the skin, it's not something that I would recommend for them either. So I think it's always best to stick to chemical exfoliants. And there are so many great options out there.
Wow, I wouldn't have even thought about that. I have been a big exfoliant. I use the Clarins scrub, and I do fall into that mentality of if I just scrub a little harder, I'll get my dry skin off.
And most people do. And that goes for facial cleansing tools as well. I am a fan of the Clarisonic brush. I think it's great. But again, a lot of people do feel the need to press harder than they need to. There's no need to apply any pressure. Just apply it over the skin and let the brush do its job. Otherwise, just use your hands. You don't want to be too aggressive on the skin.
Great. And as we talked about in our prior video, there are other ways to use the at-home dermaplaning, which we sort of landed it's okay, but not great. Rollers, etc. too.
Right.
So,
Yeah,
okay,
like I said, dermaplaning is excuse me, great at home, but it's not giving you the proper exfoliation that a professional dermaplaning would. Yeah, but it's
perfect.
great for removing the peach fuzz at home.
Exactly. Great. And then, okay, so now my skin is cleansed. What's next?
So depending on the time of day, if this is, let's say it's the morning, you want to apply any treatment serums that you might have. Maybe you have very dry skin and you want to apply a great HA serum, which is a hyaluronic acid. Hyaluronic acid is great. It holds 1,000 times its weight in water, so it helps keep the skin hydrated and dewy. Great again for patients who have very dry skin, even combination skin, or perhaps you have another type of serum that you like to use, like a vitamin C serum, which is great for brightening. Anything that is water-based, you always want to apply your water-based products first, your moisturizers last. And if you also use an oil on top of your moisturizer, oil is always going to be the last step. Yeah, so it's always water based so they can penetrate your skin first. You don't want to block it with any oils.
Oh, so interesting. Okay, so and for something like a serum, how are you caking it on? Are you patting it on? Like, is it a thin layer? Should you see it glistening on your skin?
So serums tend to go, a little goes a long way with serums, and I find that that goes for most. They tend to come in little droppers. You never want to allow the dropper to touch your skin. You're going to ruin, excuse me, the rest of your product that way. So what you want to do is either put a couple of drops maybe on your hand and then dot it on, or just drop a couple of drops on your skin. Try to be careful to avoid the eyes.
Yep.
Dot it on, work it in. Like I said, a little bit goes a long way. You want to work it in well till your skin fully absorbs it, and then you can start with your next step.
Got it. And in terms of, I know the skin on the face is a little different than the skin on the neck and then the décolletage. Is there a better, like, I know when I put stuff on my face, onto my chest, I break out. Is there stuff that you can use on your chest so that you're taking care of the full look?
Yes, so there are many products that are made specifically for this area, the décolletage and the neck. If there's a brand that you like, most like, you know, a skincare brand that you like, most likely they'll have some neck firming or décolletage firming creams or products. If they don't, I'm sure you'll find another brand similar to the one that you like that will carry. There are many, many products out there for those areas.
Can you dermaplane? Do you dermaplane the neck and décolletage too?
Yes, so I don't treat the décolletage, but when I treat someone with a dermaplaning, I will do the neck if they need it.
Okay, very interesting. Okay, so after you put on a serum, then comes the lotion or cream. What's the
Yes.
difference with lotion, cream, moisturizer?
So I think lotions tend to be more for the body.
Okay.
Creams tend to be a little more for the face, or moisturizer. So I'm going to backtrack a little bit. I know a lot of people like to use toners.
Yeah,
I don't think it's necessary to use a toner, and or can be a little drying on the skin. But if you like to use a toner, I think that it's not a bad option either.
so the toner comes after the cleansing?
Toner come after the cleansing.
Okay, and now what does a toner do exactly?
There are so many different types of toners, but toners can help maybe to, you know, like there's witch hazel toners, which can help to soothe the skin. It's also another way to cleanse the skin. It helps with the pores. It helps maybe kill some of that bacteria. There are tea tree oil toners. There are so many different types of toners that you can use out there. So you just want to make sure that you're choosing one that's right for your skin type, whether it's dry, combination, oily, acneic,
Amazing. Okay, so it's cleanse, toner, serum, cream,
Yes.
and then the oils.
Yes, and anyone who's on the dry side, I wouldn't say that it's necessary to use a toner if you have very dry skin, unless you find a very, very hydrating toner. But it's not, if you have very, very dry skin, toner might be over drying your skin. There tends to be a lot of alcohol in them or another very drying agent. So
Amazing. And how do you, for people who do have oily skin, is oil, that last step, something that they should shy away from? Because when I
I
think about oil on oily skin, it just sounds like you're exacerbating the issue.
right. So I wouldn't recommend oil over the skin. That said, that there's a bit of how do I say, like it can be a little confusing when it comes to oils because there are so many products out that are oil based, that are meant for acneic skin, like tea tree oil, let's say. When you're thinking of tea tree oil, you don't think that it would be very drying, but in fact, it is very, very drying. It's so drying on the skin that you want to dilute. It's a product or an oil that you want to dilute.
Yeah,
Similar
very.
Yes. So similar to your essential oils, like you wouldn't think that lavender would be very drying on the skin, even though lavender is very moisturizing. It's so strong, when it's, in its concentrated state, you want to dilute it. It's not a carrier oil. It's very strong oil. So anytime that there are many oils that you can use for acneic skin, that can help to kill some of the bacteria and dry out the bacteria. But again, you want to make sure that you're using it in a diluted form. But I would always recommend speaking to your esthetician about it, seeing what are the best treatment oils or acneic solutions for your skin.
I remember using tea tree and my skin became incredibly irritated by it.
And a lot of people don't realize that an oil can dry out your skin, but it most certainly can. Yeah.
Absolutely. And a lot of them are antiseptic, but it's knowing which ones and where to
Right.
put what as well.
Right.
Too.
Right.
Wow. So such good information. And then in terms of the eyes, right? Because that's a whole nother ball game of products. Tell me about like eye serums, eye creams.
So there are, again, so many eye treatments out there. There are AM under eye serums and there are PM under eye serums. You definitely want to stick to, if you're going to be using a serum, it's an AM serum, you want to use that during the day, and your PM serums, you definitely want to use at night unless they state that you can use it interchangeably. Your serum's going to be one of your last steps, but it's definitely going to go on before you apply your moisturizer.
And in terms of putting it on the eyes, right? Because I know getting close to the eyes, there is that worry that you're going to get it into the eyeball and it's going to get irritated. My question is, how close are you supposed to be putting these eye creams? Is it on the occipital lobe, or are you really supposed to be getting right underneath the lash line?
Right, so I get this question all the time as well. You want to always apply your product, feel for your orbital bone. You always want to apply it right over your orbital bone, work it in, and let the serum do its job, or let the moisturizer, whatever product it is, let it do its job. It's always going to penetrate into the skin and spread. It's the under eye area, the skin is very, very thin and delicate. You never want to get too close to the eye. You don't want to irritate the skin. This area also gets clogged a lot easier. And it's more prone to getting things like milia, which are much harder to remove and have to be removed professionally. So you want to be very careful with that area. Just stick to the orbital bone area. That includes the upper orbital bone.
So you can do the upper part too.
You can do the upper part, just don't go past your bone.
Got it. So I'm sort of the vision that comes to me. It's like a paper towel where it's like you do the outer thing and everything gets absorbed upward.
Right, it spreads. It's not going to just stick to that area that you apply it on. That product is going to get absorbed into the skin and spread. So you want to just play it safe, feel for the orbital bone, apply right over the orbital bone. No need to go past that.
Very cool. And then night creams, I'm assuming if you're going to do any type of night cream, it's cleanse it off, put it on in the morning. You probably want to wipe it off again to put on your day creams.
So if you're going to be cleansing in the morning as well, that'll do it for you. If you have very, very dry skin and you're worried about over drying your skin, maybe think about or consider changing your product so that you're not using something that's too drying on your skin, and you'll feel more comfortable washing your skin twice a day. Otherwise, you can, just use just water. To rinse your skin with water, maybe consider investing in a micro towel, so that you can kind of wipe away some of what your pores released over the night. And yeah, you can use your PM. If you're going to be using a PM moisturizer, a lot of the times those products, they have like an AHA or a BHA that can cause some photosensitivity. So it's not something that you'll want to be using during the day. Unless it says again that you can, which if it does, that means it's a very light percentage of AHA or BHAs that's in the product. And I would highly recommend using a sunscreen.
I was just going to ask you about sunscreen. Is there any reason someone wouldn't want, I mean, I've gone to the counter to buy some products and they're like, oh, do you want the one with sunscreen or not sunscreen? Why would someone not want sunscreen in their product? Is there any other reason than you want to get the sun?
Yeah, so a lot of people, we've become more health conscious, and we're really paying attention to what we're putting onto our bodies. So a lot of people are trying to avoid the use of chemical blockers. There are chemical blockers and there are physical blockers. The most well-known physical blockers are titanium, or one of the most well-known is titanium dioxide. Titanium dioxide is what people who are being a little more health conscious are applying onto their skin or looking to apply onto their skin. It's the best UV blocker. It doesn't just block UVAs, it also blocks UVB rays. So it's full spectrum. There's a lot of products out there that will contain both physical and chemical UV blockers, and they'll say full spectrum, but really the only product that covers all your bases and blocks all UVA and UVB rays is a titanium. The only other issue with titanium is that titanium is a very quite opaque product. Remember when we were younger and we'd get, the white sunscreen put all over our bodies, and of course nobody wants to look like that. So now they come up with a nanotechnology for titanium dioxide so that it goes on clear. The problem with the nanotechnology is that titanium particle, because it's become so small, it can now get absorbed into your bloodstream. So that's where the concern comes in. So there are a lot of new products out there now that are non-nano that you can apply over the skin, as well as non-nano titanium that goes on clear as well. So there are a lot of great options out there, but titanium is definitely the way to go in terms of sunscreen, because it won't only protect your body or your skin from burning, but it also protects it from aging, which are the UVA rays. And of course, nobody wants to age.
That's the goal. And that's why we come see you when we start getting a little older.
Right. Titanium is the way to go.
Amazing. That's such a good thing to know and think about too, because I know the last question is just tinted moisturizers and using that versus a foundation or both. Tinted moisturizers, what's your take on them?
I think if you like it, great. I don't think that there's anything wrong with using a tinted moisturizer. You definitely want to apply that over your sunscreen. So you don't want to apply your makeup and then your sunscreen over, because that's not going to look that great. And I get this question a lot as well. But yeah, if you want to use a tinted moisturizer, there are also tinted sunscreens out there if you'd like to use that. Those are all great options.
Sunscreen goes on first and then the makeup.
Right.
Okay.
So sunscreen is the last step in your skincare regimen for your morning skincare regimen before you apply your makeup.
Beautiful. Beautiful, beautiful. With the sunscreens, I know a lot of them are waterproof. Is there a different cleansing technique that you need to have? Like, I know when I wear sunblock into the pool or ocean, you'll see it sort of come to the surface. Does it require different cleansing protocols?
So it depends on the type of sunscreen that you're using. Again, titanium, it's a very heavy sunscreen, so you do feel it stick to your skin a little more. So you just want to make sure that you're cleansing well. If you can do at least a 60-second cleanse, that's great. If you can cleanse your skin twice, even better. So double cleanse is always recommended, but yeah, you want to definitely wash that off of your skin and let your skin breathe afterwards.
Great. And then the only other thing I've been hearing a lot about is micellar water.
Mm-hmm.
I know I have one here that I've been using. Tell me a little bit about this. Is this in replacement to a toner or?
It's not replacement to a toner. It will, however, help to remove or make your cleansing process easier by helping to remove makeup. So if you're a big makeup fan and you like to apply all these beautiful makeup products, that's a great product to have just to help remove the majority of that makeup so that you can, really get in and give yourself a really good cleansing.
Okay, so this first before cleanser.
That'll help to remove your makeup.
Yeah. And what do I do? So I know when I cleanse, right? Like, so really it's about the eye makeup, right? You might even want to start with a makeup remover. Because I know when I come out after cleansing, I've still got raccoon eyes from
so that's
and then I rub it.
Mascara and eyeliner. Yeah, especially if you're using a waterproof mascara, which can be a little hard on the lashes and not very easy to remove, you want to make sure that you're using a good mascara or eye makeup remover to help with that if you're a big waterproof mascara user.
Yep, for sure. For all that crying I do, got to keep it on.
No, don't cry.
No, right? Don't cry. I'll just pat it.
Don't cry.
Amazing. Yes. And no, my roommate back in college used to get so angry with me because she was like, please stop rubbing your eyes. Stop pulling the skin. And I wish I had listened to her because now I'm like,
Yeah.
So how do you handle cleansing this area without pulling too much?
So again, very gentle circular motion. I always recommend using your ring finger, ring fingers, just gentle circular motions to help cleanse. Yep.
Got it. And again, like it's probably the circular motion's going to help with the lymphatic drainage too.
Just circular motions, always very gentle on the skin, especially on the under eye area.
Very cool. We'll have to talk about the whole facial massage program that we're doing at Modern now too, at some point, just to help with that lymphatic drainage.
Mm-hmm.
It's certainly something to keep up with and learn from home because, your lymph system's continually working and it's important in helping us detox. So I get why you have such great skin. You've got all the codes and secrets. So thank you for sharing them with us.
And I'm not in the industry for nothing.
Yeah, no, I get
It's
that.
a lot of work. It really, yeah.
It is. Well, thank you for taking the time to simplify it for me and for everyone listening. And more to come. And we'll see you at Modern when we open.
I'm looking forward to it. I cannot wait.
Me too. Again, everybody, this is Juliana Longoria from Rothaus MD, who's also going to be working down at Modern through the Rothaus portal with us. All right. Bye, Juliana. Thank you.
Bye. Thank you. Bye, everyone.